Hi guys, my name is Ryan Courtney. I graduated from PCP with a pharmacy degree in 2014, and while on campus, I was part of Phi Delta Chi, a professional pharmacy fraternity there, in which I met a need and later became friends with them, and also I was the president of PPAG, or the Pediatric Pharmacy Advocacy Group. During my time, I also worked at a hospital in South Jersey, Atlantic Care Regional Medical Center, and became interested there in hospital pharmacy. And so I think that started to set me on the track of hospital pharmacy and where I am today.
Gianna?
Hi everyone, so my name is Gianna Eintowska. I am also a recent graduate of USciences, just graduated this past May. During my time on campus, I was very heavily involved in the Student Government Association, Rokai Society, as well as Academy of Managed Care Pharmacy. I held jobs in both community and hospital pharmacy, so that's where I found out I was very interested in hospital, and since then have taken on the role as a PGY1 resident at Jersey Shore University Medical Center.
Thank you. And last but not least, Fidelia.
Hi everyone, I'm Bernice. I graduated with my PharmD from PCP in 2016. While I was at PCP, I was involved with the Pennsylvania Pharmacists Association, ASHP, and the Black Student Union. I came in with an interest in clinical. I worked at Walgreens for a few years and then worked at Hospital of the University of Pennsylvania for about 3 years before graduation. And I currently work as an infectious diseases pharmacist at the Johns Hopkins Hospital. So here to answer any questions, and thank you for having me.
Wonderful. Thank you, everybody. Yeah. Oh, Kayla.
This is Kayla.
Oh
yeah,
my gosh.
sorry, I wasn't
Okay,
able
I
to join
see the
via
phone
video.
number now. Hi,
yeah,
Kayla.
but I'm on via phone. Hi everyone.
Great to have you.
I'm Kayla. Great to be here. I was part of the PharmD class of 2018. Similarly to Fidelia, I also came into the clinical interest, worked in a hospital close to home in Pennsylvania, was a part of the STEP program, which is a student mentorship program within the Philadelphia College of Pharmacy, and then also as a part of SSHP and a few other organizations. So excited to be here and answer any questions that you all have.
Wonderful. Well, thank you all for, again, being here with us. And if anybody has any questions, please just put them in the comments section so we can see them, and we'll get to them as soon as possible. To start it off, I know we got this question from a bunch of our, our participants or observers today, but they really wanted to know your thought process when you were going into residency and choosing your career path, and how you really identified your passion. We can start with, let's go, why not with Fidelia? Can you start us off?
Sure. So I came in with an interest in clinical. I didn't know what I wanted to do. I figured maybe I'd just start as a staff position in a hospital, but one thing I did in school, I was kind of a part of every pharmacy organization, at least for a year, to try it out. So I was briefly in the pediatric, I don't remember the full name now, but the peds group. I was in PPA, I was in SHP, and then I was also in the DIA program as well. Just I tried a lot of things, so I figured out what stuck. So I think it's important to know what you like, but also being open to try other things. So that's what I did, trying to get those experiences. And then when I was also open to new experiences. So my year was the first year they started the interprofessional education program. I don't know if they still have it, but I hope they do. But it was a really good program where, as part of your IPPEs, you were working with medical students at Cooper University Hospital and doing things like that. So my class was the first class to do that. And we did that for 3 years. So that was kind of solidified my interest in clinical. Didn't know exactly what I wanted to do in clinical until I had my HIV lesson, or HIV therapeutics block, and then I knew I wanted to do HIV and ID. I was very strategic in picking residencies, looking in locations that I wanted, looking in for programs that had my areas of interest, making sure they had patient populations that had large HIV exposure or rotations, things like that. And, you know, during school, like when you get to your API rotations, you just have to realize like you have to always be on your best behavior, try as hard as you can, because if you are interested in residency, especially in a place where you're doing rotations, you're kind of already interviewing as soon as you get there, and you want to make a good impression on those people. So those are just things to think about. I hope I answered the question.
Yeah, that was great. Thank you. Why not, Johnny, you want to go next?
Sure. So for me, pretty similar to Fidelia, I went into pharmacy school knowing that I was interested in something clinical. I went into it all for patient care, so definitely staying on the clinical side of things. So I just got as much exposure as I possibly could, taking on as many jobs as I could, and then I also did the Cooper Rowan Clinic as well. So getting the interprofessional exposure. From there, also, I'm just trying to pick my rotation strategically. So I wound up doing one of the rotation blocks that the school offers through New York Presbyterian. So I was able to get a lot of exposure into hospital pharmacy, different clinical rotations, and get a feel for what a residency would be like, and also just working in a hospital and kind of understanding the workflow and if it was something I would definitely be interested in. So I think just keeping the options open, but throughout my time, I just realized that that was my passion going through with residency.
Great to hear. Thank you. And why don't we do ladies first? And Kayla, maybe you can go next.
Sure. Yeah, so as I mentioned previously, I was interested in going into something clinical and with the start of pharmacy school. And so my first kind of exposure and getting my feet wet with working in a hospital was during my first year in pharmacy school, so my U1 year. There I worked as a technician, which I thought was an excellent experience, and getting exposed to not only you know, the workflow within the pharmacy, but also the pharmacists that I work with within the hospital were really great at kind of pulling me into situations and showing me different things from a staffing perspective. From there, our program was good also with exposing us to clinical pharmacy specialists, which is where I got my first exposure to that kind of role. I then did the summer internship program within Johns Hopkins, which had a great opportunity to see a variety of roles in which pharmacists work in a larger university setting. You know, I think within the school, the Cooper Rowan Clinic was a great opportunity to not only get interprofessional experience, but also kind of get your feet wet with working hands-on with patients, and that was kind of like my first exposure to the ambulatory care setting. And then kind of, I really worked to try to get whatever exposure I could to anything clinical within pharmacy school. So whether it be, you know, speaking to different people who had a variety of roles within hospital pharmacy and trying to see what avenue would be best for me. I do have to say that my rotations, I tried to strategically plan them to be in areas that were of interest to me that I thought I might want to explore during residency. So I do think that looking at the clinical blocks is a great way to go. And yeah, that's kind of what led me to my PGY 1 year.
Wonderful. Thank you. And Ryan?
So for me, I might be the oddball because I'm actually have more of an interest in finance and business. However, for me, completing a residency was important because I knew that no matter where I went with my career, I'd always want a strong clinical foundation. And so completing a PGY1 residency was, I think, important for that, to get that foundation and be able to do things like talk to providers from a clinical standpoint as opposed to an administrative standpoint. The other thing that was important to me is mentorship. And so I know people often talk about, and students talk about trying to decide between a fellowship versus a residency. And for me, mentorship was important. And because the residency year is such an important year of growth, that it was important to really choose a residency that's a good fit and where you're really going to be able to grow from a student into a professional.
Very nice. And Mike?
So one of the ways I prepared for residency, or at least the whole residency process, was really just chatting with different upperclassmen and saying what they liked, how their experiences were. And you know, same goes to what all of the other panelists have said earlier just a moment ago. really just getting a wide variety of experiences between weekend work, evening work. So for me, I worked both at a hospital and at a pain pharmacy throughout pharmacy school, and really just get involved with volunteer activities with EPHA, SSH, um, or even the non-pharmacy professional activities. I think just supplemented, in my opinion, just some core aspects of leadership and volunteerism. One of the other things that I think was pretty fruitful for me, I had a mentor in pharmacy school, and he recommended that I take as many electives as possible. So I also came from a family where they said, if you're going to pay all that tuition, you might as well soak up as many elective credits as possible. And I maxed out to 19 or 20 credits all throughout pharmacy school. And actually, that wasn't that bad of a thing. I took things from geriatrics to pediatrics. I took things from clinical hospital pharmacy to more medication safety and quality improvement. And really taking that lens allowed me to identify what I liked and what I didn't like so much. And being able to learn what was in the classroom helped me to understand what should I pursue during my APPE year or my APPE year. And in pursuing my rotations, I purposely chose a rotation that I knew I loved, at least the content in the didactic portion. I chose a rotation that I knew I absolutely hated in the didactic portion. And I took on a rotation for which I really didn't know much about. And weighing all those things, I thought I was going to go into critical care pharmacy and round with a team, manage patients who are on event, do a lot of ID, antimicrobial stewardship work. And down the road, I was like, you know what, I don't know if I really like that. And that's how I ended up pursuing a medication safety after pharmacy school.
Fantastic answers. Thank you, everybody. That's a great start. So I think next it would be really interesting to hear how, and this is actually a question that just popped up in our chat as well. What's your typical day like? And, you know, in addition to that, I know no day is the same, but you can just give us a little taste of it, please. And also, in addition to that, please express in some ways that your typical day has been changed by, you know, the whole COVID impact and how you've been successfully or attempting to successfully really handle the changes and the added complexities. It's kind of a loaded question, but I think the answers will be great. Why don't we start? Mike, do you want to just take it and we'll go in reverse order this time?
Sure, that sounds good. So, hey, my attention span is not that great, so I apologize. The first question, I believe, is what was your residency day like typically?
Or just your today typical day, or you can go on residency a bit too. Just whatever your choice is, whatever your preference is.
Sure. So they're all quite different, to be honest. My PGY1 year was very clinical. I did my PGY1 at Penn State St. Joseph Medical Center, and it was a very unique practice in that the PharmDs there were able to partake in collaborative pharmacy practice agreements. And myself and a co-resident, some of you might know Justina Frempong, or Dr. Justina Frempong, he and I would manage medications for blood pressure, diabetes, and cholesterol for our patients. And we had prescriptive authority in that we would write the order, and then there would be a verification piece by the physician where we would then send it through an all-scripts order. And that was a neat practice. Not many people have had that. I was able to even partake in things like skin puncture biopsy and identify, you know, based on the eosinophils, did we see truly an allergic reaction to certain antibiotics? That was my PGY1 residency program, very clinically focused. My second year was a medication safety residency. And so I did mine at St. Jude Children's Research Hospital here in Memphis, Tennessee, actually. And a lot of my day-to-day activities during my PGY2 year was projects, meetings. I would do a lot of data analysis, connect with folks who work both in the clinical and non-clinical arena, and really translate what does that impact actually mean from a hospital leadership perspective. So two different avenues from a trainee residency perspective. So that was probably about 4 or 5 years ago now. Where I am today as system medication safety officer, with coronavirus, it has been such a unique and challenging thing. One of my responsibilities as the systems med safety officer is to really identify what are our risk points. So not only do I work with pharmacy colleagues, I work with nursing, physicians, and other folks to figure out how do we standardize care. One of the main issues we're experiencing right now is just the allocation of remdesivir, the standardization of steroids, and the appropriate management of our patients who may or may not necessarily exhibit certain symptoms. It's now come to making bioethical decisions. Do I use remdesivir in patients who have a lifespan of 6 months or less? So really, I'm getting pulled into all sorts of things between supply chain, the typical patient safety initiatives, and day-to-day medication outcomes work.
Okay, thank you. And Gianna, would you like to go next?
Sure. So for me, just starting out residency, my day-to-day is focused kind of on like the clinical side of things, typically what I believe most resident days are like. So right now, depending on what rotation I'm on, so I started this month on my oncology rotation. I round with the team in the morning, sometimes as early as 6:30. So rounds end pretty early, and that's really the majority of my day is working out patients, preparing for rounds, rounding with the team, and making my recommendations there. Coming back from rounds, inputting any of my recommendations. So if I recommended starting a new medication, I have the ability to order that medication and have it get signed off by a physician, which is pretty cool, kind of going off the idea that was mentioned earlier about the prescribing practices. And then after that, my afternoons really vary. So having topic discussions with my preceptor for the month. So typically having like 2 to 3 topic discussions a week. So making sure I'm prepped for those. I have a research project that I have to be working on, and things just kind of come up. Like today, I had a DI question that came up that took extensive research to do. So I had plans for the day to work on other things, but sometimes things don't necessarily go to plan. So a lot of my things had to get pushed off to work on something that had popped up that had higher priority. But typically my day is, as I mentioned, rounds, clinical things in the morning, and the afternoons are more of my catch-up time. And then fitting in staffing, the staffing requirements that come along with residency as well.
Thank you. And Kayla, would you like to tell us a little bit about your day-to-day and how COVID's affected it?
Sure. So I just recently transitioned to my new role out of my PGY2 residency into the clinical pharmacy specialist role within medical oncology. So my day was similar to Gianna's when I was a resident in that the morning was spent working out patients, getting prepared for rounds, going around, making your recommendations, following up to make sure that those recommendations have been inputted by the physicians or ordering whatever levels you need to. And then the afternoons were generally topic discussions, attending meetings, attending afternoon rounds, which the majority of our teams do, and, you know, following up on any kind of research or topic discussions to prepare for the week, anything like that. Now, as I've transitioned into my new role, I think my days have been similar but different in that, you know, my mornings are generally very patient-oriented, preparing for rounds, you know, making the recommendations like I would as a resident. My afternoons have been more so with meetings and following up on patient things, and I look forward to also starting to eventually work with students in the spring.
Fantastic. Fidelia, would you like to take us next?
Sure. So I am an ID pharmacist. So COVID has impacted us a lot. So I work at the same institution as Kayla. So the structure of my day is similar to Gianna's and Kayla's, where there's a lot of patient care in the mornings, and then your afternoons are built for any leadership, administration, research, teaching, things that you have to do. So like I have a lot of learners. So last 2 months I had a couple students, and then I have a RPGY2 ID resident coming up next month. So we do a lot of supporting of the residency class. So we have a class of about 30 residents, and they're all onboarding in this first part of the year. So a lot of that we have things like vancomycin competencies that we have to get them signed off on and things like that. So that's kind of what my afternoons have been looking like. As far as how COVID has affected me particularly, so I rounded our inpatient HIV unit, and then that was in March, transitioned very swiftly to a COVID unit, and then not a COVID unit, and then maybe a COVID unit. But now we're like kind of back to HIV and infectious diseases, and the structure has also changed because the new academic year started. So as we're onboarding pharmacy residents, we have new medical interns who started, and I used to not work with interns. I used to work with second year medical residents, and interns are like straight out of medical school. So that's been an adjustment for us too, but we have these new structures in place just in case COVID surges in Maryland. So it's been a big shift for the whole hospital. Like the whole hospital has, the medical residency structure has changed to make sure that we're accommodating if we do surge again. So that's what it looks like. But the clinical pharmacy specialist role, I would say in general, is just a lot of balancing your patient care with all of your administrative and leadership responsibilities as well. Just like Gianna said, your patient care is mostly focused in the morning, but as soon as something comes up, or if you're on the code pager and there's a rapid response, you might have laid out your day a certain way, but things come up, and patient care is always the most important thing. So it's a lot of balancing and managing your time. So that's just something to keep in mind in general.
Okay, and Ryan?
So for me, all right, 1 second.
Looks like we had a false fire alarm.
You could come back to me. My fiance was cooking dinner, and
Sounds good. We'll come back to Ryan.
now I think we're good. Now I think we're set now.
Okay, wonderful. I know you have a really interesting, I think some interesting input on this. I know you transitioned into running your hospital's COVID response to some degree, from what I understand.
Yeah, that's correct. So as COVID started, I took on a new position in our oncology cancer center. And so I'm currently working as the clinical pharmacy supervisor. So supervising 3 oncology infusion centers and also our inpatient oncology unit. And then when COVID started, as most health systems did, we launched several COVID testing sites, and recently they've fallen under me. And so we've hired additional temporary staff, which now fall under me. And about 1 day a week, I work to supervise the clinic and triage patients, assist in ordering testing supplies, things of that nature. And so as far as challenges with the COVID times, initially for us, it was all about managing COVID and taking care of patients. And now as COVID continues, but things start to level out, it's difficult to manage on one side that aspect, but also continuing to push the health system forward. Christiana is currently working to stand up a health system run specialty pharmacy. We're currently in the process of acquiring a hematology practice, and prior to COVID had acquired a 3rd hospital, Union Hospital in Elkton, Maryland. And so we're trying to balance that. So that's definitely challenging, while also taking care of patients in the immediate time.
Wonderful. Well, that's some, interesting stuff. It definitely doesn't seem like any day is what is expected, and certainly a lot of different answers, which is nice to hear. So next, I think we heard a bit about, all of you enjoying mentoring and even having some, learners under you, which I think is a great segue to really focusing on your tips, or one super tip, or just some of your tips on, how to be the most successful resident and how to make the most out of your residency experience. Maybe Fidelia, would you like to start us off?
Yeah, I think for residency, I think you would just have to be as open. That is your year to learn as much as you can. You're never going to have that like protected year to just learn. So just getting as many experiences as you can and just being willing to work really hard is what's going to keep you going and get that residency if you're doing that as a student as well. But in your residency year, I think that's like the most important thing. It's your protected time to continue your learning. You won't be able to go over everything, but the growth that happens in that year is just so phenomenal, and where you start out is definitely not where you end. So just being open, being willing to learn will get you very far.
Thank you. All right, and maybe Mike.
Sure. For really students or residents, I always think just keep an open mind. I think someone mentioned earlier that these rotations, these residency programs, essentially they're either a 5-6 week interview, or in this case of residency, it's sometimes a 1 year interview. And I could probably see that, you know, Feedy probably did a fantastic job at Hopkins. I think you did your residency there, and then now you took on a specialist position. And really that's pretty common in a lot of organizations. If you think about it, organizations, residency program directors, preceptors, we invest a lot of time in you. And so our hope is that you as a learner, again, whether you're a student or a resident, will be able to take what you've learned and try to take it to the next level. And in some cases, we want you to keep that knowledge in-house. And so that's why we'll end up hiring you in many cases. I've worked at a number of organizations, and I've seen this happen in numerous times. And really the best way to do that is really just get involved with projects. If a preceptor is looking for a little bit of assistance for things that are volunteer related, helping with data analysis, maybe it's a publication, sign up for that. If anything, you'll just learn and grow from it, and you'll identify if you like it, great. If not, you know, that's probably not your cup of tea, and that's okay too.
Fabulous, thank you. Kayla, would you like to answer next, please?
Sure. So I would agree with the statement about taking that year or two to really challenge yourself, stay open-minded. But also one thing that I really tried to focus on is really taking responsibility for your patients. Even though you do have a preceptor that's there working with you, that year or two is for you to have that clinical backup if you need. But just try to really take responsibility and treat it as if you are the specialist on the team, you are the information source. Because one day you will be, and I think it's nice to try to challenge yourself to ask that person who you're learning from, you know, what was your thought process to get to this answer? How do you think through different scenarios? Because, you know, you can read and you can teach yourself information, but learning the thought process from somebody who knows a lot more than you do, I think was one of the most valuable aspects of residency for me.
Thank you. And Gianna?
Sure. So for me, starting off, I don't know if I necessarily know the best things, but what I've learned so far, at least throughout my first month and a half of being a resident, I think just really going above and beyond as much as you can. So even if someone just asks you a question, and you can give them the response, but always digging a little bit deeper, because I'm sure something will always come up again, and just making sure that you take the opportunity, of course, it's been alluded to, but learning as much as you can during this time. It's definitely been a transition from being a student. You are a provider now, you do have a license, so things do fall on you. But I think just overall taking the opportunity to learn and yeah, taking on as many opportunities as you can. Don't say no to anything.
Well put. And Ryan?
I like what the panel said. I think in recent years, some people have started to do residencies as more of just a check off the box kind of thing, which is certainly okay and understandable because the job market has become so difficult to get clinical positions in industry and in hospitals. But just like the panel said, to really use this time to grow, use this time to try new things. In terms of research, it's a really great experience that you get during your residency, and it can really set you up to for a bright career by taking advantage of any opportunities you get.
Thank you. So next, I would like to, hear your input about where you see really the clinical hospital pharmacists in the future and how you see the profession migrating over time. Maybe Mike, would you like to start us off?
Sure thing. So where's the profession going? There's a wonderful report. I'm just going to give a plug here. ASHP, the American Society of Health System Pharmacists, has a wonderful pharmacy forecast report that a number of pharmacy leaders have really been involved with. And they project different different growth, different decrease in practices. One of the things that they talk about is artificial intelligence and also pharmacogenetics. And I know some of us are already working in the fields of pharmacogenetics. Where I trained, we actually did a lot of pharmacogenetics work in all of our pediatric patients. And I think that's just going to be common. The other aspect too is artificial intelligence. So being able to have how to data mine, use big data and identify which patients have a greater likelihood for stroke, sepsis, poor outcomes associated with really complex medication regimen. Where I worked at just recently, we actually started doing some things, I shouldn't say we, but where I was previously, they started doing some things with readmissions in the pediatric world. So I think it's already here, but I think it's just going to be exciting as the coronavirus pandemic has hit. A lot of new things have, maybe not new, but newer things have started to really just evolved even more drastically. Take telehealth, for example. I think that a number of pharmacists now are being employed to provide medication counseling remotely. They're providing these specialty pharmacy services, drug information services, all remotely as well. So I'm excited for what the future has. And I think that learners and even current practitioners, we have to be well aware of what those changes are and how can we adapt to those in a rapid environment.
Thank you. And Kayla, would you like to answer next, please?
Sure. I guess from a clinical perspective, from what I've seen, from my time being a student up through this very point, is just that I think that pharmacists are just becoming a lot more integrated and dependent upon within the healthcare team. I think that, our teams are looking for our pharmacy input, both when you're on and when you're off. So I think it's a great thing that our teams are, looking to pharmacy to have answers as the drug expert. So from a clinical perspective, I think we can only look forward for, how integrated we are to be in the future.
All right, thank you. And Ryan, would you like to answer next, please?
Sure. So from my viewpoint and my background, before I got into clinical oncology, I was in 340B and helped to implement a 340B program at ChristianaCare, my employer. And for anybody who doesn't know, 340B is a somewhat obscure but more prominent in recent years drug pricing program that allows health systems to buy discounted medications for eligible outpatients. And this is extremely important in the oncology fusion space. And I say that because I think the future of clinical pharmacy will be in the outpatient space will be starting to merge the reimbursement, payer, and managed care aspect to clinical pharmacy. And so currently in oncology and fusion, we have a new world of biosimilars with various payers and various entities working together, and a whole slew of new oncology drugs. And it's extremely important to look at these and compare what's best for patients and to review data regarding some of the oncology agents. They're starting to come out with subcutaneous injections where a patient just has to get a quick shot as opposed to an IV infusion. And so there's some challenging questions how that fits in, what reimbursement looks like. And I think clinical pharmacists can become able to understand that and look at different payers and different reimbursement models and be crucial to that, and which is a really primary revenue stream for health systems, which in recent years is extremely important as COVID has really affected the bottom line and the financial organizations, especially health systems.
Interesting. Thank you. And Gianna?
Yeah, so I think clinical pharmacy has really progressed over even just the 6 years I've spent in pharmacy school. Pharmacy is so involved with the medical team, whether it be in the hospital, in the ambulatory care clinics, really everywhere in medicine at this point. But I think it'll be interesting moving forward, especially now as a resident. I work so closely with the medical residents. So while they're completing their residency, they notice that pharmacy has such a presence. So I think moving forward, when they become attendings, they'll always be looking for that pharmacist input. So I think it'll be interesting to see how the doctors will always be looking for pharmacist input in the future.
Yeah, definitely interesting. And Fidelia, could you express your opinion?
Yeah, so kind of piggybacking off of what Mike said, I think there'll be like changes in regards to how we interact with data and building, I guess, the fusion of data and technology. One of the things we've done at Hopkins is we've created this like HIV assist program, which helps, non-ID trained, non-specialized practitioners provide care for HIV positive patients. And like just building that huge database, what it does is you input as much patient information as you know about about your patient, and then it kind of spits out different regimens that might be appropriate for that patient. It gives you data and it ranks them and gives you data and tells you like why this was ranked above the other ones and things like that. So my colleague in the outpatient setting helps with inputting things like drug interactions and things like that, and things you need to know specifically about the medication. So I think that is a growing area, as well as like informatics. I think in the last couple of years, I've seen a much bigger interest in focus on informatics from a pharmacy perspective. That it's a growing field, and it's so important now that I work as a specialist and I'm interfacing with like Epic and the builds behind it. I think that will continue to be more important too.
Thank you. So as as we hear more about your work, it does sound really great, and you're definitely making important patient impacts. But I also want to really get a chance to hear what you deal with on a day-to-day that's frustrating. What's one of your biggest frustrations on the job, and how you've grown to manage it, and what are your tips in managing those frustrations? So we can start with maybe Kayla.
That's a good question. I think something, not sure that I have very many true frustrations, but one that I guess that has been one thing that's been impacted by COVID is kind of the way that we interact with our teams. Our practice has been largely shifted to Zoom. We had Zoom rounds for a period of time, which all of the medical team, our social worker, us as pharmacists, everybody was kind of transitioned to Zoom rounds, and then only the person who was, examining the patient or the attending would go and see the patient individually. That was a large transition from, being, able to see your patients on a daily basis on rounds. Now we've transitioned to allowing only 2 to 3, up to 4 members of the healthcare team to be on our rounds within the oncology center. So again, that constant transition in communications and trying to always make sure that we have optimal patient care in terms of continuing education for our patients and things. I think COVID has definitely impacted that, but I think moving forward, it may also allow us to positively impact patients, and in that we won't necessarily need to do everything in person. We may now be able to do more Zoom education, or kind of expanding our abilities to impact patients on a larger volume moving forward. So I think, although it was frustrating at first, I do think that there are positive aspects of every situation and things that we could take moving forward.
Great, thank you. And Ryan, could you take it next?
Sure. So for me, 2 things. One, from a general aspect, is definitely time. So residencies were a really good opportunity to start to develop time management skills. As I transitioned to a clinical pharmacist, workloads definitely increased, and you're juggling more things around. When you move into a supervisory role, it becomes exponentially increased. And so now, again, trying to prioritize becomes extremely difficult. In addition to that, when you're working with members of your own department, specifically a pharmacy department, it can be still challenging, but a bit easier to knowing that everybody's working for the same goals, the same direction, et cetera. But as you grow and you start to deal with other departments where they have different goals and different priorities, and providers in different outpatient clinics that again have different priorities, it can be difficult to keep everybody aligned in the same direction. And some of those priorities can conflict, and there can be friction, and so it's definitely more challenging.
Okay, interesting. Thank you. And Fidelia, can you take us next?
Sure. I think for me, it's just there's never enough time in the day trying to balance all the things that you're balancing. And you learn that in residency, and it doesn't change after residency. You just have to keep getting better. Sorry, Gianna. But, you know, you just have to get better, and you have to learn like what you're prioritizing. And you know, the to-do list can't be overly ambitious. So things like that, because you also need to have a life and things like that. And I think the other thing, I think if you talk to like any pharmacist anywhere, you would love to have more staff. You would love to have more of you in whatever clinical area you're in, whether it's oncology, ID, medicine. You would love to have more staff so you can get more things done as a department and things like that.
Okay. Gianna?
Similarly to everybody, time is definitely a frustration. I spend like 10 to 12 hours a day at the hospital, Monday through Friday, and I feel like that's still just not enough time to get everything done that I hope. But definitely just time managing as time goes on. Another frustration, it was funny, it came up today. If I sometimes making recommendations to the team isn't as open as I would hope to certain recommendations that they decide just not to go along with. So for me, starting out, it seems a little frustrating, but I think just as time goes on, realizing choosing which battles really to fight, and then kind of just following patients with the team. And then if anything, if something is serious, being persistent. But for me, that was just a slight frustration to see in the beginning.
Okay, thank you. Mike?
So I echo what everyone says pretty much. You know, time's definitely one factor, but I'm probably in a unique role compared to others in that I serve as the med safety officer. So I actually deal with cross-functional teams all the time. In fact, leading a team of nurses and some physicians from a clinical standardization piece, and then now partnering with pharmacy operations. And so it's always finding that balance. Just as Ryan said, you know, how do we align our goals when we have various departments who have their own competing goals? And one of the ways that I think it's always good for doing this, figuring out what's your team charter, you know, what is in your scope, what's in and out of your scope, because depending on the project, you could go, you know, 1,000 miles wide, but only a foot deep, and then vice versa. You really need to go, you know, a foot wide, but really 1,000 miles deep. And really, I think the best way to do that is really generating short-term wins. And I feel like if you can map out the process and figure out, okay, friends, let's do X, Y, and Z, and let's try to get at least to here. And when you're involved in different teams with, whether it's, in my opinion, clinical or non-clinical, I think that developing those short-term wins is a good thing. But the other thing too is remember that it's about progress. It's not perfection. I think that when I used to round with the medical team, I'd want X, Y, and Z recommendations when I'd be in medical intensive care unit. And sometimes you can't do that. And you got to figure out what are the immediate needs today and try to aim for those things. And that's what I try to employ with my project management work style as I manage cross-functional teams, occupational therapy type issues from a fall risk perspective, from a med safety side, to all the way IT related med safety issues. So I think the general principles are there, but it's all about how do we manage our teams and necessarily nudge or more influence our superiors or influence our attending physicians.
Thank you. So, you know, we've heard a little bit also about, like Mike just mentioned, cross-functional teams. And we talked to also, and it was mentioned that, you know, the role of the pharmacist is definitely becoming more of a pivotal one of these teams, and something that really has turned out to be a benefit over the last, you know, recent future. So can we get just your number one tip for how you successfully work with and in cross-functional teams? Maybe Fidelia, can you start us off?
Yeah, I think the thing is it's building relationships. You are way more likely to achieve your goal if you are someone that people can get along with. So the clinical stuff you'll learn, but like you have to be like a person is what I like when learners come on, like the doctors are people, the nurses are people, we're all people trying to work for the same common goal. So literally just trying to build a relationship with them, like okay, say you make a recommendation or you say something and they're like, oh, I don't really want to do that. You can ask why. You don't have to make them feel like, oh, they're being ridiculous or anything. And who likes to be scolded, right? So like you have to think about like if you were in their shoes and they may have a very good reason for why they're not taking your recommendation and you are not aware of that information. So being a person, building relationships and having some humility will get you a long way. And when you build those relationships, you'll build more trust and you'll be able to further your goals eventually.
Thank you. Gianna?
I think definitely just being personable, speaking with the doctors, Fidela kind of mentioned, just they are people too, and just being personable with them when you're walking through the halls. Something else is just being that reliable source, so never leaving a question unanswered if something came up on rounds, and if you couldn't answer it there, making sure that you're always following up. If you're able to provide them with like accurate information, they'll always be able to trust you in the future, and you kind of build that relationship. So even if maybe you're not rounding with their team, they'll be likely to reach out to you if they have something else that comes up in the future.
Great. Ryan?
So for me, definitely regarding physicians and other providers, listening and understanding that their experience is very different than pharmacy. So pharmacy, going back to school, remember that we often started with pharmacology and then started to move to disease states and therapeutics. Physicians are kind of the opposite, right? They start with disease states and physiology and then move to learn the pharmacology and the drugs. And so I think sometimes the friction between providers and pharmacists results from that differences of background history. And so definitely, as some of the other members of the team said, relationships is very important, and just understanding that there's a reason why sometimes they don't agree with us. It's not necessarily that they're anti-pharmacy, but they just have a different background. And so their priorities may sometimes be a little different than ours.
Thank you. And Kayla, what's your experience been?
Yeah, so I definitely have to echo the fact that building relationships is absolutely huge with your team. I think another aspect is, which was also touched on, is communication. So the way in which you present your recommendation, or the way in which you convey your goals for the team is really important. And listening to the other person or the other provider's goals as well, and trying to understand where they're coming from. Like Fidelia mentioned, just because you give a recommendation and it's not initially accepted doesn't mean that you have to take that as a defeat. But trying to understand where that person's coming from can help you to evaluate how you're communicating and try to better yourself and making recommendations in the future.
All right. And Mike?
So I'll probably give more of an academic answer just because I just lectured on this last semester. There's a guy named John Cotter. If anyone hasn't heard of him, Google him. John, everyone knows how to spell John, but Cotter, K-O-T-T-E-R. He's a past professor at Harvard's Business School. He talks about the 8-step process for cross-functional teams and really just making outcomes and making change. And the first is developing that sense of urgency. To figuring out, what is the priority there, and how do we all rally towards this common enemy, whether it's a disease, whether it's a project, whether it's some sort of financial implication. The second now is building that guiding coalition, and that highlights back to how do we form those relationships. I personally, even during COVID, I'll have these one-on-one coffee meetings or just these quick touch base meetings with folks just to see, hey, how's everything going? How are your kids? How's your spouse? And of course, we try to get work done, but within that 30 minutes, we just figure out what are some of those things that are going on in our own personal lives too. So just relating to them. The third step is forming strategic visions, initiatives, and making sure that we're all aligned towards that. Then it's about enlisting that volunteer army. So besides that core group of pharmacists, who else do you need? Maybe you need a clinical nurse specialist who works in the ICU. Maybe you need a physician medical director to help you get other physicians on board. Then you enable action by removing barriers. I think that whether you're a pharmacist or a manager or a director, it's all about figuring out how do you make it easy for your team to do the right thing and hard for them to do the wrong thing. I think that's a lot of things that we do in med safety is automation and enforcing functions. It's, the gas station example, these diesel pumps actually don't fit into our regular cars that use non-diesel pumps because it's a forcing function. And being able to develop those things sets ourselves for success. Next, you generate short-term wins. So again, how do you create those quick team activities? How do you create those easy T-ball type pitches? That way our team can easily have that momentum of winning. You just build that camaraderie afterwards, then you sustain that acceleration. And then afterwards, you just keep on instituting that change. And that approach, I really recommend it. I'm probably giving more of a detailed academic approach, but I feel like if you take those 8 steps, whether it's in the clinical world or the non-clinical world, I'm sure you won't always get the perfect outcomes, but it will be pretty smooth if you think about it. So friends, Google John Cotter. I think it's like 8 steps for change management. And it's a neat approach, especially if you're doing a pharmacy admin rotation for those who are learners out on this Zoom meeting, or if you're already leading different types of projects.
Thank you. Wonderful. So I think a lot of these answers have been applicable to not just, residency or clinical life, but to any profession. So very wise, and thank you for a lot of great answers. We do have a combo of current residents or people going into their residency and a couple of students. And just to finish us off, I just wanted to address some questions. And Gianna, if you could start us off with, it's kind of a loaded question, but what time of the year did you start applying for residencies? And what kind of factors helped you achieve successfully getting one, including GPA requirement, how much they look at that? And I think a couple of the other panelists can really help address this question.
Sure. So I started looking at residencies probably like around September. August, September, I started looking at all the different programs, creating a list based on proximity to home, areas that I would want to live in, or hospitals that I found interesting. And it was a very extensive list that I would later cut down, looking at different pros and cons of each program. But really just taking into account all the different programs that there are and not leaving any out, and just taking a peek at what they have and not keeping any closed eyes. In regards to things that set you apart, GPA, so I think I've never been on the other side of things, so I don't know if they necessarily look at GPA, but of course just trying to keep your grades up as much as you can. I did that throughout pharmacy school, and I was as involved as I could be throughout school as well. So that allowed me to talk about a lot of different experiences that I had on when I went for interviews. I was able to talk to so many different experiences that I've had. Whenever they gave situational questions, I always had something that I was able to attribute it back to. But aside from your experiences and your GPA, so that's what they see on your CV and your resume that you submit, but you're also typically submitting your letter of intent. So in that, you're really able to show your personality. And I think that's also so important, because maybe if you don't have those experiences and you don't necessarily have the GPA that they're looking for, they're still going to see a part of you in your letter of intent, and that could still get you your on-site interview. And then once you're on site, it's really just a matter of hitting it off with the people that work there and just being personable, of course, being professional, but making sure that you can have conversation. And these people are going to work with you every day. So they're going to want to make sure that they pick someone that they could get along well with, and vice versa. You definitely want to do the same. So progressing through, looking at programs like September-ish, narrowing down my list by like November, because mid-year came around in December. I got to talk to different programs, and that helped further narrow down my list. And then it's interview time come January, February. So
Okay.
try to answer everything, but let me know if I missed anything.
No, that was great. Thank you. And maybe one of the other panelists, do you want to address how much of a factor GPA is, or any other tips to really distinguishing yourself? Mike?
I actually think, and these are my personal thoughts, this is not that of the employer for which I work or any of the organizations that I'm involved with. GPA is as useful as looking at, I don't know, I don't find it useful. And maybe it's because I was probably a lower GPA person compared to other individuals, but I always feel that what determines a person's success is not some academic number that you can take by a Scantron test and a number of exams. I don't think that's real world. I personally don't think that GPA should be heavily weighted in the whole residency application process.
Okay.
Gianna, I think you mentioned that you place your GPA on your CV. I actually never did that for me. And I think everyone's different depending on where you are. And but I think after a year or so, no one really cares about your GPA. People want to know what you're actually doing. They want to see outcomes. They want to see patient impact. So if you have a low GPA, and I don't know the context for which the person raising the question is providing, but if you have a low GPA, don't be discouraged. Remember that that GPA is just a number, that you're more than that numerical value. So I always just, I'm very passionate about when people bring up GPA and using that as a poor measure for success. So I just wanted to throw that out there.
Okay. Does anybody else have some comments? Ryan?
So rest of the panel, keep me honest, but the residency programs that I've seen are generally points-based in when they choose an on-site interview for a person. And so generally, unless someone's GPA is extremely low, they're kind of just set. And unless their GPA is something like a 4.0, then they might get an extra point. But it's tough. You know, residencies are extremely competitive these days. So if there's one bit of advice I could give, it would be that don't wait until you're applying to make an impact. So on rotations, I really enjoyed some of my inpatient hospital clinical rotations to the point where at Cooper, and I excelled, that they actually approached me and asked me to if I was interested in applying to their residency program. And so don't wait till you're applying, you know, try to work at hospitals. I ended up doing my residency where I worked as a pharmacy technician at the hospital. And so don't wait till your application because it's so competitive. You know, really look prior to that on rotations and during your work experience to try to meet hospitals and preceptors and to really try to make an impact there.
Great. Thank you. Fidelia or Kayla, do you want to add something?
Yeah, really quick. So I think GPA, like your GPA is not going to get you the residency or not get you the residency. Just keep it as high as you can, but it's not the end all be all. The one thing that I will say is, especially since residencies are so competitive now, one thing I wasn't really aware of, or I just pure ignorance, I didn't know until later in my schooling, was like, you should also try to get involved in research. I think that also helps because research is going to be a part of your residency. And if you are interested in doing like a clinical specialist work or working in a large academic medical center, you will likely still continue to do research. So that is something you can do to either make yourself look better or try to get more experiences in other ways on your CV if that's what you're looking at. And it'll also be a skill that you that will go with you. Just like when you do seminar your last didactic year, you will give presentations, you will go back to everything you learned in seminar. It's going to help you just moving forward. So that's just one bit of advice I would give.
Fabulous. Thank you. And Kayla, if you don't have anything to add?
Yeah, I would agree with everything that was said. I do think and feel strongly too that GPA isn't the end all be all, that you do have to be a well-rounded individual. So whether that's in your work experience or your publications or your research, like Fidelia said, definitely try to involve yourself on campus as early as you can with whatever it is that you want to be involved in. I know this wasn't really the question, but I think I do have to pass along this one bit of advice because I think it was the most valuable thing going into interviews that I could have received from Carrie Pack, who was a previous alum. Is when you're going into interviews, try to think about, 4 to 5 scenarios in, your career, whether that be involvement in organizations or work experience, and make them stories because people love, stories. So whether it was a really impactful thing that you had with patients or whether it was, your involvement as the president of an organization, how you really helped to, move that organization forward, bring up 4 to 5 scenarios and really get them solidified in your mind and what your impact was from beginning to end. And kind of make that a focus in preparing for interviews. Just thought that was an important thing to pass along, even though it wasn't, one of the questions.
No, that's great. And I know Mike was just commenting that also, starting networking, you can't do it soon enough, especially with social distancing being a factor. And also using the STAR method, which is something I used in the past, and it's really great. Google the STAR method to find out basically the guaranteed way to properly answer any question and to be a really amazing interviewer. And with that, I think I thank you all for your time. I know we went a little over, but that's just because we did have some great things to cover and your answers were fantastic. This was recorded, so I think we're going to be sending it out to a larger audience, and it'll be really impactful for a lot of current students and recent graduates. So thank you again. I've learned a lot, and I think that all of you are doing some incredible things. So thank you for your, for what you do on a daily basis, but also thank you for participating on this panel. All right, and with that, I'm gonna just wish everybody a great night. Stay in contact, network, and it's great to see so many great USciences and Philadelphia College of Pharmacy alumni. Have a good night, everybody.